because it's already 6:05. So Shan sir?
Yes.
Yes. Can we start? Is everybody is in? Yes. Good evening, everyone. Nice to see you all. Welcome from SNIC Rehab Foundation. I'm Harshali Kharche, founder and a director of SNIC Rehab Foundation. Welcomes you in very most awaited topic from our speech therapist. SNIC is a Special Needs Integration Center. Rehab is rehabilitation, empowerment, health, advocacy, and belief. Here, our vision is to empower parents of children with special needs by ensuring their peace of mind, satisfaction, and positivity with respect to their child's overall development. Our mission here is to sensitize and educate the society about the challenges faced by special needs parents, also to provide an appropriate perspective to the parents about treatment, therapies, and approaches in favor of child's development, to bring better clarity about myths, beliefs, and misunderstanding with regards to issues, disorder, and dysfunctions. Our motto here is to set foundation of parents' body capable of providing resolutions to the changes faced by parents of children with special needs. We have with us Miss Vinita Puri Shrivastava ma'am on a very important topic like connect, communicate, and converse with your child. Supporting individual to the effective communicator in social world. I'll give a brief introduction of ma'am. Vinita ma'am is a certified speech and language and clinical director of GIG Human Communication Center, a private speech and language therapy center specializing in pediatric speech, language, and social communication deficit such as autism disorder. She is skilled healthcare professional with over 22 years of experience in both clinical and teaching work. So welcome, Vinita ma'am. Over to you, ma'am. You.
Thank you, sir.
I'll just stop sharing. Yes.
Thank you so much, Harshali and your team. Thank you for having me here and giving me this opportunity to talk to a big family of yours. I think today is my first day with this family, so it's a lot of getting to know everyone. So thank you once again for having me here. As you've mentioned, it's a very important topic about connecting, communicating, conversing with individuals and with their loved ones. So we have this as a very important a topic that is a very essential and a very important part of our lives, something that we assume in our daily lives. But today we are going to really start thinking a little bit more about understanding these 3 C's of communication: connecting, communicating, and conversing with people around us. So help me to help you break this down, and thank you all for being here. And I hope that we will be able to do this together. So without much ado, I'll probably move on and tell you a little bit about, as Harshali had mentioned, I'm a speech and language therapist. And yes, I am still, I would say, learning, still trying to find out more about autism and understanding communication through an autism lens. I think this goes on for a lot of us. The more individuals we work with, the more we understand them, the better we are able to support them. So I think it's a journey for me. I wouldn't say that I know much. I'm still learning. And a lot of us are still also trying to, find out more and fix the pieces together. As we all have really heard that it is like a puzzle. It is something that we are constantly looking at the little bits and pieces and how that can make sense in this social world. So I think what we need to really understand is to get to know ourselves, get to know the people and our loved ones who may be experiencing communication difficulties as a result of autism. So today we're going to really focus a little bit more on the social communication aspect, the difficulty, the concern, like we see in autism. And we're going to talk a little bit more about communication and understanding their difficulties, and then probably be able to support them after we have understood what they experience. So I am actually a speech and language therapist. So a lot of what I look at is from the communication perspective, from the social interaction perspective. And my emphasis is more on connecting with people, connecting with the individuals, and then helping them engage with the world. So that's what the focus of this two-part series would be, to equip ourselves as parents and professionals to be able to better support our young learners or young individuals or older individuals who may have been experiencing some significant concerns relating to communicating with their family members or communicating with people at their workplaces, in there, and to help them integrate better into the social world that they live in. So this two-part series, what I've done is I've actually had an agenda for each day, so that we are able to really have a more structured way of sitting and listening to what we're going to really receive. So day one, that's today, that's part one. We're going to really understand communication per se, a lot basics about communication, how the individuals that we are trying to support, that we are trying to better support, and the reason why we are here. How do individuals communicate, and why do they do that? So the purpose behind their communication or the behavior they actually exhibit is something that we want to really study better. So autism communication is something that we're going to really try and break down today. And then, yes, supporting it the right way. So making a right decision as a caregiver, as a significant caregiver, to really use a very effective pedagogy or methodology to support them. And we're going to really focus more on making a connect with them today. So some useful tips for parents and professionals before we, end our part one today. So that will be the takeaway for today, to really think of some tips on how we can connect and engage with these individuals right away. And at the end of our talk, we would have a fair bit of time left for us to, discuss any questions that could be personal, or it could be something that you've been thinking about, or issue, any concerns from the talk, areas that you didn't really understand. So we could probably have time for Q&A at the end of the talk. So the second part of this series would really focus more in detail about key relationships in communication. When we talk about communication, what are some of the other things that we are looking into? For example, behavior, play, social interaction with others. So these are some of the key terms I would use when we talk about relationships in communication. after all, we all want to hear the good practices. So that's something that we will be discussing, effective and evidence-based strategies that are have been well researched and well documented. I would share some of those, and we would probably be able to better understand how we could apply them in our daily lives, in our everyday routines with the people that we are trying to support. We will also talk about some tips on how we can create communication temptations in our daily lives, in our routines, that we don't need a therapist for, but we could actually start doing it right at home. So especially in these COVID times, when we are not able to really have a lot of physical sessions, well, how could we actually better equip ourselves to practice a lot of these communication techniques and strategies right at home? So the second part would deal more with some of these tips. Okay, so today we're going to really start talking about
Uh, yeah, got disconnected.
okay, so there's some okay, I hope everyone could hear me. Are you
Yes,
able to
yes.
see me? Okay.
Yeah, now we can. Yeah.
Okay.
We
All
can
right.
see.
So today we're going to focus a little bit more about understanding communication, and communication being such a basic, essential skill of life. We're going to really try and understand how important that is for all of us to be able to communicate, not just well, but effectively. So today we're going to really start talking a little bit about that connection that we make with people when we are talking to them or we are communicating with them. We're trying to understand them or listen to them. And there is some sort of a back and forth exchange happening in a very appropriate manner, in a very, very nice fashion, which is very quick and which is something that happens with relative ease for most of us, with others around us. So this is something that we are constantly engaging in and connecting with people in this kind of a back and forth exchange. So today we're going to really start thinking about that communication is something like this back and forth exchange that maybe you can visualize a game of tennis. Tennis, the way we have the ball going back and forth and the two players actually constantly, hitting with their rackets, constant back and forth exchange of that game happening, that is something like communication. So when we are really thinking about communication, think about how accurately and how much effort we're actually putting into that whole exchange happening. So there's a sender and someone who's actually saying something. So we could actually say something by using words, and we say it to the person who is on the receiving end. And the person who's receiving has to pay attention and receive a fair bit of information and then process it and then probably say something back. So just like in a game of tennis, this kind of back and forth exchange is constantly happening and happening in a fashion that is accurate in most of us, in typical individuals, and with relative ease. This is something that we call communication. So we do connect. We connect with the person that we are trying to communicate with. We try and have appropriate body language. We have appropriate cues when we are actually wanting to have that kind of a back and forth exchange with someone, and we gear up towards it. Our body, our words, our gestures, our eye contact, our tone of voice, everything works together in an appropriate manner, in a nice fashion, to make communication successful. So communication, a lot of things happening in this back and forth exchanges. Again, the things that we are relating to others is the messages. So these messages can be words, can be many other things. It could be gestures, it could be body cues, like when I may actually turn my body, make sure my body is facing towards the person I'm trying to communicate with. So the messages are going through in many ways, not just through words, but in many other forms as well. And these are just some examples. And also our facial expressions, right? So these are the messages that we are kind of relating back and forth with the people we are communicating. And they are sent, of course, for many reasons. So I can request something, I want something, and have a communication with someone. I could actually refuse something, that I don't like something, and that could be a form of communication. I could show someone something, I could make a comment, that could be communication. I could answer a question, that could be communication. I could just chat about a topic of my interest, that could be communication. So there can be many, many reasons for why we have these constant back and forth exchanges in our lives. And these interactions happen in a two-way fashion. And this two-way fashion is the key word here, that we want to really make sure that any interaction or any communication is socially appropriate, is meaningful, and is in a two-way fashion happening between the sender and the receiver, and so on, right? So back and forth exchanges in an interaction are the key for communication. The more we engage in such interactions, the better our communication, right? So interactions generally are a very complex skill, complex for all of us, and it's something that involves effort. What I want to highlight here is that communication is not something that we can't be bothered about. We have to be bothered about what we are communicating. We have to pay attention to what we are saying or what we are trying to relay as a message. So it does involve effort. And that's why when communication is a difficulty, it is also becoming very, very effortful for those who have that difficulty, and for those who are trying to understand individuals with difficulty. So it's both ways, right? It can be socially challenging, it can be demanding for everyone, and especially more so for those who have difficulty relaying these messages or understanding these messages clearly, right? So interactions and communications, again, quite hand in hand, and we have to understand both of these key terms together, right? So looking at communication, if I want to summarize this, it allows you to understand, uh, the message. The messages that I just mentioned could be the words, could be the body cues, could be the facial expressions. Communication is all about really understanding a lot of these things. When I say someone's communicating, I want to make sure that they do understand all of these messages in many, many ways. And they are also understood by others. So communication involves understanding others as well as, and their messages, as well as being understood by others. And of course, it happens in many ways. We, of course, use words like what I'm doing right now. I'm using words to communicate. Yes, predominantly, I'm able to use words to be able to relay a message. And all of you here today are able to understand what I'm saying because you're able to comprehend the words I'm using. But I can also communicate in other ways apart from the words that I've just used, like my body cues, my body language. I'm trying to look towards the screen. I'm trying to face the camera. I want to make sure that everyone can see me. I'm trying to understand how people could view me. The facial expressions, to make that connect, I'm trying to make sure, I'm putting an effort to make sure I'm able to connect with all of you. So it has to be done in a meaningful fashion during an interaction. And that is the key about communication. So communication is a very big umbrella term, and a lot of things happening under that term. One is, of course, the words we use. And a lot of us think that communication is about speaking, but it is actually more than words, right? So to summarize, and something that you want to take away from the word communication, it is more than words. It's not just words. And today we're going to really try and understand this big term communication through an autism lens, and try and understand autism communication per se, and how do they communicate with their significant others in the social world. So we'll try and understand the word communication from an autism lens today to better be able to support the individuals with autism and other related social communication difficulties. Okay? So communication, as I mentioned, requires a lot of effort, even typically. We need to make way for communication to happen. We need to, put in some effort. It's not going to just happen on its own. We all do that, right? It is socially challenging. It's demanding for everyone. But we, you and I, are able to handle it with relative ease, yes. Some of the individuals with autism, as a result of their autism, have communication as one of their key difficulties. This is often an area that is quite an essential area and becomes a difficulty because it requires a lot of effort from them to be able to socially, reciprocally interact with others. They may lack the words, or they may lack the understanding of what people were trying to tell them, or they may lack an understanding of what was going on by interpreting body cues, facial expressions of others, or take their perspectives. We know that theory of mind is something that's an area that has been heavily talked about in autism, right? So communication as a difficulty, as a concern, is a hallmark in autism. And that's something that we all hear. That's the reason we want to hear this, because how are we going to really help them break this down, help them really equip themselves with these necessary strategies to work on this area of communication? Because the social world out there is a challenging one for all of us. And we need to equip ourselves, make sure that we create a toolbox that has many tools that we are able to kind of use as and when necessary. No one tool would help any one individual. We know that, right? So we need a good mix of these tools to help the individuals that we are working with and trying to support. So understanding the communication needs in autism is something that we are trying to do today. We do understand that in autism, communication is something that's compromised. Again, it's a continuum, and I will mention about the communication continuum that I'm talking about, that you may have individuals who may be able to just exhibit their basic needs, or even have some difficulty indicating their basic needs, while others may be able to indicate their basic needs well, but may have significant difficulties with connecting with others socially, making friendships, having a conversation, and so on. So you can have an individual lie anywhere on the continuum of communication. And today we're trying to understand this communication continuum. That where a person could be and how do we then support them, right? So we do understand, and we are understanding this fact that difficulties in autism relating with communication are a hallmark. And we do know that this is something that we want to really support, right? So individuals with autism, some of the key things that we really observe in their communication style, I would say, or in the manner in which they communicate, is that often we observe them that they are communicating not in a very conventional manner. We use the word unconventionally. That means if you have an individual who is 5 or 6 year old, he may not be using words to communicate his needs or his frustrations, his desires, his thoughts, but he may use other forms of communications like crying, or when he's upset, he may throw things or push adults away, or he may hit others, hit his peers if they snatch a toy from him, or things like that. So they may use more unconventional forms of communication to indicate their needs or their desires, or things that they got a bit upset about, right? So autism communication, when we think about, we got to think about the unconventional communication. And as a therapist, as a parent, as a professional, our goal is to move this individual from unconventional communication, moving him towards conventional communication, teaching him how to communicate conventionally. And this is where we're going to really talk more about supporting them. Okay, so right now we're trying to understand how generally individuals with autism communicate. So a lot of unconventional communication when their needs are unmet, right? They also lack ability to initiate communication with others. A lot of the times we hear parents telling that he can answer a question. He can tell us in 1 or 2 words. A lot of closed-ended questions again. He may say yes or no, or he may answer a question at times. Yes, he's beginning to do so, but he doesn't initiate. He doesn't ask. He doesn't feel the need to come to us and say things, or come to us or approach us and talk to us about anything, or tell us about what he did, right? So this is a key concern in autism communication. They do have difficulties initiating, okay? They may also have difficulties in responding appropriately, but a lot of the times we do notice that parents are starting to feel that, yes, they are responding, but not really, asking on their own, not initiating at all, right? So if we prompt them, they may say something. If we ask them, they may respond and answer something, but not on their own so much. They're quite happy by themselves, and they don't feel the need to come to us, need to inform us or tell us, right? And last but not the least, they also have difficulties interacting with others. And we talked about some of the interactions earlier about this back and forth exchange that a lot of the individuals are experiencing significantly, right? So this constant back and forth exchange of messages, the messages could be anything. It could be things that they may that may interest them, or things that may interest others, but they may have difficulty just having an interaction with people. It could be just making simple friendships, or just wanting to have a chat with a friend. This is something that they find extremely challenging, and there is a higher degree of social demand associated with this. So we do understand that a lot of the autism communication, some of the key areas, this is what they are facing, right? Now, communication being such an essential thing, and if there is a difficulty, if there is a concern, if there is some amount of effort that individual feels the pressure for, or feels the demand for, it does impact them in many ways, right? So there is a huge impact, or a very big impact of these communication difficulties when we're talking about autism. I've listed some of them, and I'll probably go through them one by one. And we will also be expanding these in the second part as well, right? So behavior, I would like to mention, is also communication. To a speech and language therapist, behavior is communication. A lot of the times when we observe unacceptable behaviors or challenging behaviors of young individuals or older individuals with autism, there is always a reason why they do so, right? And that is something that they're trying to communicate. So they may have been upset and they are on the floor, why they didn't get what they wanted to get. So there may be behavior, which is of course unacceptable, but it may have resulted because they didn't have the necessary words to communicate with, right? So a lot of the times, the way we look at it is that behavior is communication. And we need to really understand that if an individual has a communication difficulty, we need to really monitor his or her behavior and support the behavior as well, right? So this is something that we want to keep in mind, supporting behavior and supporting communication. This goes hand in hand, right? We also observe, and a lot of parents keep coming to me and telling me about that individuals with autism do experience anxiety. They do feel anxious about being in a social interaction or being in that exchange format with someone or being in a chit chat with someone. They experience a huge amount of social demand. And this is something that we have just heard that we all experience. Social interaction and communication is a very complex skill and is a very socially demanding skill for everyone, more so for those with autism, right? So we have to understand the underlying anxieties. We have to keep in mind certain strategies to reduce anxiety while we're working on communication, have ways to work on anxiety as well, side by side. So again, anxiety and communication also go hand in hand, and we got to work on it together. We need to reassure and understand the anxieties they may be experiencing, acknowledge them, right? Instead of just shoving it away, we acknowledge them. That they may be experiencing that, and that it's okay to experience that, and we work towards it. So we may want to use maybe a very structured way of maybe a schedule to help them understand what's going to happen and when they'll finish, instead of being worried or anxious about how long this conversation will be going on for, and so on. So we may want to have a way to tell them and make them more prepared in a very structured fashion, and that's the way to kind of support the anxieties they may be having related to communication, right? Social interaction, again, is something that is a big impact on that, because we use words to interact with others. And if an individual is having limited words or having very few words, and is struggling with that, struggling with the thoughts, struggling with the right words, they're having difficulties finding the right word, the right vocab, then they may have a difficulty with interacting with others. So it does impact the social interaction, the friendships. It does impact the relationship with others. And this is something that we want to also target, we want to work upon, and we want to support, right? A lot of individuals with communication difficulties experience difficulties accessing the school curriculum. And here I'm talking about the academic curriculum that we are working with, or that individual is working with. So we need to really monitor, we need to really support them using appropriate evidence-based strategies. How are we going to support their learning, of the curriculum, of the demands in that curriculum, of the different subjects that they are working with, and so on, right? Employment is a big thing. A lot of our young adults and adults with autism, we are trying to work with building soft skills with them, getting them more ready for employment with these employment readiness programs that nowadays a lot of therapists like us, we are working with adults as well to support them, right? To help them, to build awareness, to equip them with how they could actually work with their difficulty and not let it be a handicap, right? To really support it and to be confident in their communication with others around them. So it could be at the workplace, or it could be at home, or it could be with their friends outside in a mall. So we're looking at various settings, right? What we are really talking about is that communication does impact their life skills, their learning across different settings. And we need to have a good program should be able to support them in different settings and across different people, right? And finally, we want to really talk about how we can include them in our society and support them, right? So we want to really, the big goal is to integrate them back to the society, to include them rather than exclude them and let them do what they're doing, right? We want to include them, coach them well, guide them, support them, and to build their skills, to rehearse what they have, to give them new set of skills, and to make them more functional and independent, right? So these are our big goals that we're always wanting to think about independence. We're thinking about how we can make them more functional. Now, a little bit about diversity in autism. A lot of us may know this already, but I'll just kind of go through it briefly, that individuals with autism have lots of challenges with communication. We just talked about their social interaction, their social skills, but that may vary from person to person. Like I said, we are looking at a continuum, and any two individuals with autism as a diagnosis may not be the same. They may have different challenges, relating to their communication or social interaction, and they may exhibit these abilities or these skills in different ways, right? No two individuals are alike. We know that, and that's what makes autism something that we are constantly exploring, right? We are constantly trying to find out, even as professionals, even as parents, we're constantly trying to work with the individuals to find out more about, their experience from their view, how they see the world. So this is something that we're constantly trying to understand, right? So some people with autism, we know that may not talk. They're not using words or have very limited or little speech. They are not using enough words. They may be understanding, but they're not really using words by speaking it, right? So we don't really hear a lot of words from their mouth. While others may talk well. Others are able to combine words to make a short phrase or a sentence. They're able to tell us a few things, which is great. But those who are able to talk may also have difficulties with the more advanced set of skills that we are talking about. Like, they may have difficulty understanding the body cues of others. They may have difficulty with interrupting others or being interrupted by someone, right? They may have difficulties taking perspectives. And they also may have difficulties making friendships. So a lot of the individuals may have the words, may be joining the words. They are able to make simple sentences and communicate, but they may still have difficulties forming relationships using these words in a more appropriate fashion. And we will talk about these subtle skills soon, right? So diversity in autism, we're thinking about this communication continuum where you may have individuals who communicate just for their needs on one end, and then you may have individuals who are beginning to communicate for many reasons, but they may also need some support in terms of these subtle communication skills that I just mentioned, how we could kind of fine tune them as well, right? So you may have individuals who may lie anywhere on this continuum, and they may definitely appear different. No two individuals may appear same in their communication style, right? So we just want to really give it a thought in terms of the individuals we work with and how they are on this continuum, right? So it's important to determine where an individual lies on this continuum before we support them and their communication style. So to me, as a speech and language therapist, I think the key thing is about really understanding them, where they are in this communication continuum, right? So today is a lot about getting to know, and getting to know not me, but getting to know the individuals we work with. And when I'm talking about the individuals we work with, we're trying to think about how they communicate. The medium, the means that they use to communicate. They can use words, like we mentioned. Some are using facial expressions. They may be using some gestures. So they may be using many ways in which they may communicate and indicate their needs. The message, what they actually are trying to say. So it's important that we understand the message. What are we trying to say? And then the purpose or the intent. Why are we trying to communicate? So I would like all of us here to keep these three things in mind when we're thinking about individuals with autism, is to really understand. This is a lot of the assessment that we are thinking about, trying to understand them, trying to get to know them. And a very important part of understanding their communication style. So first, we're going to really think about the how, right? Most of us think of how, when we think about how people communicate, what comes to our mind? One of the key terms that comes to our mind is speaking. Yeah. We think of speech, we think of the words we use when we are thinking about how people communicate, right? So that's what we are thinking about right now. But there may be many, many ways. These are just some, right? You may think of many more. So we can communicate in many, many ways. We could write a message. I could gesture. I could touch someone to communicate. I could wave and communicate. I could look at someone and I could communicate that, sometimes when we just have a very, when we're looking at someone, your eye gaze tells a lot. We could read and we could understand others. We could grab something from others and that tells us about what they may have wanted. We could use pictures and that tells a lot about what someone is trying to say. We could point and that tells us about what that person may want or may have a desire for. We could also talk, yes, we could also type a message and so on. So there are many, many ways in which we are able to relate a message. There are times when you may have a young child who may pinch us, who may come and pinch us when he's not in a good mood or he's upset, right? And that pinch tells me about why he may have felt that way, right? He's trying to tell me something, that he's not happy about what just happened. So he's pinching to tell me that, and that's communication, right? So there may be many, many ways in which you and I and the individuals with autism communicate. Crying, of course, is a predominant one. Whining or crying. A lot of our individuals with autism we talked about are often observed to unconventionally communicate and relay that message with others. So there are many, many ways. And just looking at language and communication now, that when we understand individuals or when we are trying to understand people around us, we understand people through many, many ways, not just one way by listening to what they may have said, right? So spoken words is just one way, right? We are trying to understand and take information from many, many, many ways or forms, right? So text could be one. We could read something and understand. We could understand someone's body language, facial expressions, eye contact, someone's written message or written text, and so on. So we understand information through many, many forms, right? And that's something that's important to really think about, the medium or the means by which we understand information around us. And of course, we express ourselves through other ways too, right? One of that is through speaking, right? So a lot of us think that speaking is one of the ways of, or one of the main ways of communication, or speech is communication. Well, that's just one of the ways, right? So a lot of the times, if a parent comes to me and says that, my child is not communicating, he's not talking, to that I usually say that yes, he is actually not talking. Yes, he's not talking the necessary amount of words for his age, but he is communicating through other ways. Yes, he's trying to pull your hand when he wants something. He's trying to point when he wants something. He's trying to touch you or his body part when he's trying to indicate that he's wet or he wants a change. So he's trying to communicate, but he may not be communicating conventionally using speech. And that's the goal for a speech and language therapist, for a parent, for a professional, for an educator, is to teach them a more conventional way to communicate. Yes, right? So there are many ways we understand, many ways we express ourselves. Speech and speaking is just one of it, right? So that was about really how people really communicate, right? Moving on to the next segment, which is dealing with the whys, right? The purpose or the intent. Why we really need to tell others, why we need to say something, why do we need to go to people. This is where we really need to start thinking about, right? There's always a reason why we go to people. So we request for things. Yeah, we may want to tell them something that we've seen just now. I saw a really nice dog outside. I want to tell my mom I saw a dog outside and it was so cute. We may refuse something. We may reject something. I don't want it. I don't like this. We may want to communicate when we want to give information about something, right? We may want to comfort a person. Someone's not feeling so good. He's very down, not feeling too good about himself. I want to comfort that person. I approach the person. I want to talk to the person and say a few words or have other ways of, making the person feel better. It could be just giving a bouquet of flowers or writing a card, right? So there are many ways to comfort a person. Having fun socially with others. Yes, we want to always go out with our friends, have a good time, sit in a cafe and, just keep chatting. That's communication. That's the reason we want to go and talk to people, because we feel good. We feel good to be around people who love us or who we really have a soft corner for, right? We also communicate when we want to resolve any conflict we've had, right? When we talk about relationships and communication, there we do understand that relationships. It's good to have good relationships, but there are times where we need to really work on our relationships, and when things don't go the right way, so we need to work on and repair. So the repair is important. There are no relationships that always are consistent. They keep changing. So it's very dynamic kind of interaction we have with people, and it's bound to have its lows. So we need to really think about, when it's a low, what do we do about it? So we communicate in these lows to repair things, to fix them, and to kind of move on, right? We negotiate. Lots of language is needed, lots of words are needed when you want to negotiate. No, I don't want to do this today, I really don't want, I'm very tired, can I do it tomorrow? All that is communication, right? And there's a reason why we communicate, right? And of course, last but not the least, we want to really make a lot of friendships. And so communication, there's a big need for us, right? We want to make a good friend, or we want to make many good friends who stay with us. We want to make best friends forever, and we need to communicate to make them, right? So we communicate for many, many reasons. There are many more. I've just listed some of them. So this is a little bit of a DIY, do it yourself, is to think about the individuals we are trying to support. Now, all of us here probably have some individuals in our mind who come right away and we are trying to support. And it's a good thing to really now start breaking down communication, trying to break down why my child or the individual I'm working with is doing things the way they are doing, is communicating the way they are communicating, right? So we want to really first try and think about these things, that why they may be doing it, how they may be doing it. So for example, a young child may want to request for his favorite toy, but he may be doing it by pulling mama's hand. So how is he doing it? He's actually pulling mama's hand to get his favorite toy. So that's the way he gets his needs, right? Met, right? So the requesting is a need, and it's one of our core needs. And so this particular individual, a young child, is doing it by physically pulling someone's hand. So we got to really start thinking about how a person is doing it. And if we do feel that that is unconventional, and that for his or her age, I need to now try and have some strategies, equip that individual and support him to be able to move him towards more conventional communication. So I may have in place certain strategies, which I will talk about in a short while, to really equip this individual to make that change, that I want to teach him how to request in a more appropriate fashion. So this is why this chart helps us. And if we try and think about the individuals we are trying to support, we are better able to kind of understand people that we are trying to support. And the support plan, the communication plan that we want to make will be more suited for that particular individual, right? So as you can see, a lot of the, under the Y column, you will see that a lot of the initial skills are need-based. And need-based communication is a lot to do with requests, simple requests, refusing something or asking for help. These are need-based communication. And if you look down in that column, you will see that ability to ask questions, complain or negotiate, having a conversation or making friendship. These are more social in nature, and that is a lot more social communication. So we really need to start thinking about the individuals and where they are, the ones that we are trying to support, right? So we have to start thinking about them, and maybe this is something that a lot of you as parents and professionals could do it as a little handout at your convenient time, and that will give you a better idea about the individuals that we are trying to support better, right? So we have just, let's assume we have just understood the individual's communication style. This is the way this particular individual communicates. That's his style. Now, it's up to us to really decide now, as a significant caregiver, whether we want to make changes to better support their current style, right? So first, we have a list of things that are telling us about the person's communication style, and then we decide and make a decision as a family, as a professional, how we want to better make that change and better support and equip this individual to make that change, right? So I may want to teach this young individual now to have a more appropriate way, a conventional way to communicate his request when he wants his favorite toy. Instead of pulling mama's hand, I want to teach him either to say a word, or I may teach him to use a picture to communicate, or he may use an assistive device to communicate, and so on. So there may be an appropriate way, a conventional way to request for his needs, right? So that's the change that I want to bring about in his communication style, right? So we have to, hopefully, we are all thinking about making that right decision. And of course, the answer is a big yes. We all want to do that, right? So when we think about autism communication, we are thinking about supporting it the right way, right? And thinking about some of these individuals, we have talked about it, and I will reiterate this, that when we're thinking about individuals with autism, we do have individuals who speak, and we call them speakers, and individuals who have very limited words for now, and they are not speaking as many words as they should be in order to conventionally communicate for their age, right, with others around them. So when we're thinking about autism communication, we want to really start thinking about where the individual lies on that communication continuum and how we're going to better support them, right? So as I mentioned earlier, a lot of our young individuals are at the need-based communication stage. So we do start with the need-based. We do start here building up on their fine-tuning on their needs, how they communicate their basic needs, which is requesting, commenting, asking for help, refusing things. These are the needs that we're talking about. And moving towards the social communication, which is a lot more demanding in nature. And that's where a lot more, where interaction is involved, and the challenge is felt more. So we want to really equip them more with these subtle skills to build their language and communication further. So we do start with the needs and working towards the social communication side, right? So communication in autism, a lot of the times we hear from parents that it is prompted. My child can say things, but I have to prompt him, then he says it. I have to say something, push him to say it, then he says it, right? So a lot of us will agree to this, that our individuals that we are supporting currently are a lot at the prompted stage. So they need that prompt, they need that cue in order to indicate their needs, or in order to answer a question, or in order to share information, and so on. And of course, the big goal is to really move them towards being spontaneous in speaking. So as a speech and language therapist, when I work with families, this is what we are agreeing to achieve, right? This is what our big goal would be, is to build their communication, move them towards spontaneity, move them towards independence, right? Just like we're talking about the other skills, the ADLs, the other life skills, we're also talking about the communication to be more independent, right? And this is what we want to achieve, right? So the big goal is to really assist individuals with autism to communicate in a more meaningful and functional way. And when I talk about functional means that an individual is able to spontaneously and independently communicate, right? His needs, his desires, his wants, and then be able to socialize with others, right? So we all understand the importance of the word functional here. And that is the big goal for all of us, right? And of course, now we better understand that, of course, this can happen in many ways. It could happen with words, it could happen with gestures, it could happen with signs, it could happen with pictures, and it could happen with assistive devices, right? So we will talk a lot about all these things that I've just mentioned, but this is what we are really moving towards, right? So teaching and supporting communication with an autism focus, that is what the highlight is. And again, I want to really talk about the journey we have, is that we communication along the way, right with very young children, supporting their communication, working with teenagers, young adults, and also working on communication in adulthood, right? So we want to really work along the way and support the individuals all the way till adulthood, right? In terms of making them more functional, spontaneous, and independent, right? Okay, so teaching communication, when we're talking about teaching communication with an autism focus, we are really thinking about some of the evidence-based strategies that have been well documented in research. And these are some of the things that I'm going to share today. You may have heard some of these programs. These are very well documented programs, and a lot of us as therapists and also parents have been equipped, and they have been using a lot of these very useful strategies, approaches, and techniques with their individuals to better support their communication, right? So some of them I will just list that have been the ones that have been very well documented. One of them is the structured teaching approach. I would call it more of an approach that we use when we are thinking about autism. We are using this to better equip our individuals and give them a lot of structure, give them a lot of prediction in what they're going to be doing, in what they're going to be receiving, and how much they're going to do in terms of having a work system in place and supporting their communication using their strength again, which is visual in nature. So we are using visual supports a fair bit to support and to include their strengths. And we do know that, individuals with autism are visual learners. And that's one of the reasons why we adopt this strategy, and it works really wonders, right? So one of the very, very, very useful technique, a very big one that speech and language therapists are using, incorporating some of these principles into their teaching, communication, right? Another very useful program that we have is the Hanan program, which is the one that I've mentioned here in the slide, is the More Than Words, again, that is being designed for autism in mind. And it's a very useful program. And again, a parent program where we equip parents with the necessary strategies, the necessary tips that they could use right in their homes to work with their children and build their communication in a more meaningful fashion, right? The Teach Me Language is another program that a lot of therapists like me, we use to build the necessary language skills when we're talking about the advanced language skills like grammar, and we're talking about pronouns and how to teach them the necessary language skills that may help them with their academic learning in schools as well. So we use certain programs which are well documented, and we incorporate some of their techniques into building their language and communication further, right? Picture exchange communication system is a very popular one that a lot of you may have heard of. Has well documented and well researched tool that it supports an individual's communication again and again. It's a very visual tool, that includes their strengths, and this is something that we've been advocating for, right? Do, Watch, Listen, and Say is another very useful intervention program to build social communication skills in autism, and one that I've been using personally a fair bit. And again, it's something like we usually notice that the coordination of doing something, watching something, listening to something, and saying something is it needs support in individuals with autism. It's something like multitasking. They may look at something, but they may not be listening, and they may not be looking at it. And this is the coordination that we are really building constantly and working with. So it's called the Do, Watch, Listen, and Say, a very useful program that therapists may use to support communication, right? And last but not the least, parent implemented intervention, which I will talk a little bit more about because I personally would really strongly advocate for this. Parent is often a key player in intervention, a very essential part of intervention and support. And what we really do is work very closely with parents so that they can build these language techniques and strategies that we share with their child in their daily routines. Right? So we work very closely with parents to equip them and to give them some general suggestions in how they can actually turn any interaction into more communication opportunities at home. So we want to create more communication temptations at home, and that's why we want to really work very closely with the parents so that they better understand what we are trying to say, right? And there's a lot of strong research support that parents have a very positive effect on their child's communication development. So this is not something from me, but from research, right? So a comprehensive communication support plan, it includes a combination of teaching methods, not only any one that I may like, right? So there may be a combination of pedagogies that I may use and I may recommend for any particular individual with autism that they may find useful and that would enhance their communication skills, right? So no two people, no two individuals are alike. We know that fact as a fact. And we also know that no one technique will support that individual's communication, right? So we may have to use a combination of approaches, a combination of programs to better support them, right? So a few things that we need to really remember when we are really working with individuals with autism, that the need to individualize. We want to really focus on how we can
understand this particular individual better before we support them. And that is why I had requested all of you to do the DIY earlier, is to get to know the individual you're working with. Get to know the individual we're trying to support. Because that's the key, right? To individualize. So try and understand what they're good at. What are their strengths? And of course, we do know that we tend to, unfortunately, focus on the things that not so good first, right? And those are the weaknesses. But try to also think about their strengths. What are they good at, right? What can my child do well? What is he really good at? Is he good at drawing? Is he good at math? Is he good at music? Or anything else, right? Think about what interests them, what motivates them to learn or do something. What motivates my child to do this activity, right? I want to know that as a parent first, as a professional too, right? And I also want to understand their communication style. And that's exactly what we've done today, is to understand the communication style of the individual we are trying to support. Okay? So building essential communication needs, I said that we move from need-based communication towards social communication. And what are these needs? We want to really support and build these needs. So for young learners or young communicators who are not able to indicate their needs very well, we want to start supporting how they request first. We want to teach them how to ask for help or a break. I don't want to do this. I need a break. I want a break for 1 minute and then I can come back to the task or the activity, right? How do we indicate a yes or a no? A very important life skill to be able to indicate yes or no. Do you want to eat rice? Yes or no, right? Do you want to go to the toilet? Yes or no? A very important, an essential skill that we need for life, right? We also want to be able to build their ability to tell us what they like and what they dislike. It's okay to dislike things. We don't always like everything. There are many things I don't like. It's okay. But it's important for me to share that. If someone's asking me something, I need to let them know I don't like this. And then that's okay. I can always look for an alternative, right? It is not a must-have that I must have something I don't like, right? So we need to also regard their feelings, regard an individual with autism, respect their feelings, respect that they don't like something. It's okay, right? And the way they express their feelings, their emotions, right? It's very important that we build their ability to be able to tell us when they are not feeling good. Many times the behaviors that we talked about, the unacceptable behaviors, arise from when they are not feeling good, when they are upset, their needs are not met. That's when the behaviors are often seen, often observed, right? So we need to build these essential communication skills, right? And again, the social communication needs, where we are heading, we said we need to move towards the social communication. And these are some of the areas that are a lot more challenging, a lot more complex. So we are moving from simpler to complex, easy to more complex. Like asking questions is a lot more harder than just answering a question. Okay? When I'm asking a question, I need to be able to combine the necessary words, have an appropriate intonation for a question, and so on. Clarification, negotiation, engaging in a dialogue, right? These are often a lot more advanced, a lot more interaction-based, and a lot more challenging. So we move from need-based towards the social communication needs, and that's where the progression is when we are teaching them, when we are equipping them. We also work with them how to build simple friendships, right? How to greet a friend, how to answer a friend, how to find out about a friend, what he or she likes, right? So we may do simple activities to tell them to work on these simple friendship skills, right? We also work with them how they could initiate a topic of their interest first, and eventually of maybe someone else's interest that is not of their interest. So it could be a topic that they prefer, and eventually a topic that they do not prefer, or maybe a neutral topic, right? We also want to build a social understanding of subtle skills like the volume. Are you speaking at an appropriate volume? Now, a lot of us, when we are talking to people around us, when we are in a crowded mall, we usually speak at a higher volume because of the ambient noise around us. When we go to a library, we automatically adjust our volume, monitor it, and reduce it to an appropriate whisper. We're able to do that. A lot of individuals with autism have difficulty fluctuating this, right? Moving across these levels. And often we observe them to be either too loud or too soft. So this monitoring ability of their volume is something that needs support, right? Maintaining appropriate distance between people when we are talking. We talked about body language. We talked about, so there's another aspect of body language when we look more into detail into body language, that's called personal space. And how far do we stand when we are talking to people? How close can I get to someone? And again, remember, it moves according to the relationship circles. I can go close to my mother, but I can't go very close to a stranger in a metro train. If the train is not that crowded, it may look inappropriate. So I gauge this. I have an appropriate social understanding that when I need to maintain distance and how much distance, and when I can go close and it's okay. It's a crowded metro, it's a peak hour, it's okay to stand close. I don't feel offended. So we need to really build that understanding in more advanced learners of communication, right? This is something that we are trying to build with them. Okay. So moving on towards making a connect. And today we're going to end this talk by thinking about some of the tips that we could use right away to start making a connect with the individuals that we are trying to support. And when we're talking about connection, we are talking about connecting and communicating, right? So simple things, we want to call an individual by their name so that they know that we're talking to them. So remember, when we are giving an instruction, a verbal instruction, or we are trying to get their attention, call their name before we give them an instruction or send a message, right? We want to make sure that they are connected, they are with us when we give them an instruction, or before we give them an instruction, right? Or before we ask them something, right? A lot of the times, if you notice that the individual is engaged in doing something else, we may do a countdown before we even call their name. So we may often say 3, 2, 1, and then call their name. And by doing that, we want to make sure that by the end of the countdown, they are with us. A lot of the times when we do this, one way of checking that the person is with us is when he tries to maybe turn or give a brief look, or may start counting with us. And if a child is doing that, or if an individual is doing that, we know he has connected in a way. And then we quickly move on to the other part of the instruction that we're trying to say, right? And make sure that we use their special interests to engage with them. And this is something that is a key when we think about autism and supporting autism communication. Use their interests, include their interest. And that's very important to engage with them, right? Of course, a lot of parents may say that, oh, I do include their interests, but then they only want to talk about these things. They only want to do what they like, right? Of course, we do want to expand their interests at some point. We do want to expand their topics at some point. Maybe they could talk about other things. I know they like to talk about maybe food, but they could also now engage with and talk about maybe other things like holidays or, events or places and things like that. So it could be other things that we could also talk about, right? So some of the things that we want to keep in mind when we are thinking about supporting autism communication and the individuals that we work with, right? So that's all from my side today. And in the first part one, today we have actually covered a very important section on how and why we communicate, and to really understand the individual's communication style that we're trying to support, right? And to build a connect with them. Some effective pedagogies that have been evidence-based, and ones that a lot of professionals like us, speech and language therapists, are using. We're trying to kind of use a combination of these pedagogies to teach individuals or to build their communication skills, right? So do take a moment to think about any three things that you may have found useful, or you may have thought about it a bit more, and two things that maybe you could use them right away at home or maybe at your workplace, and one idea that you may be able to use absolutely immediately, right? So start thinking about a lot of the things that we mentioned, but you may want to pick and revisit some of the key things that may have moved you or may have interested you today, right? So thank you so much everyone for listening. I know it's been a long talk, but thank you so much for listening, everyone. And we're now open for some questions.
Yes.
Over to you, Harshali.
Yes, ma'am. Wonderful. Not at all lengthy. I mean, it's a lot of knowledge. So we could hear you for more time.
Thank you.
Yeah, there is
Thank you
one
so much.
who raised hand. I'll just Shilpa, you can unmute and ask your question.
Ma'am, thank you for that wonderful session, ma'am. My son is 6 years old,
Thank
and
you.
he's non-verbal, ma'am. Actually,
Okay.
I would like to know how to choose the mode of communication, ma'am. See, be it pictures or how do I zero in on one kind of communication? At times, I feel that he doesn't watch pictures, but how to zero in on the best way of communication, like pictures, gestures, or is it gestures or pictures, like those things, ma'am? That's my question precisely.
Yeah. So at the moment, I would like to throw this back to you again. Is how does he communicate at the moment? Like he's using pictures, or what is the more easy way for him to communicate with, or how?
Ma'am,
Or
I like pictures. He doesn't watch, ma'am, but still I'm trying. Maybe some, because in a mobile he can just pick a lot of videos with the smallest of thumbnails. Okay, so
Okay.
I'm just, but when I show him a picture, he doesn't look at it. But with that hope that since he is looking at the mobile with the small thumbnail, I'm showing him pictures. Gestures, I'm teaching him one or two. He picked up and he asked for the things that he is interested the most. So
Right. So
I'm still, yeah.
yeah. So the way I see that he, like, if he's interested, he will engage with even the smallest thumbnail on
Yes,
the device, right?
yes, yes.
But it's the people's interaction, it's the people skills that we want to really build more, right? So I would say that we really need to establish a more conventional system with him to communicate effectively, because at the moment he's choosing, like sometimes he may use some of the images, and at times he may not respond to the images. So maybe if you do have a speech and language therapist that you work with, you may want to decide on a system that we could use with him. There is a very popular picture exchange communication system that taps on their strength again, that is visual, and we would be able to then build a more conventional way in which he would be able to indicate his needs, his desires, and so on, right? And it has to be consistent, because at this point of time, he's choosing that when I want to show something to mommy, I can use the device, but not always. So we want to really work on building that. And what we have mentioned earlier, that of course, pictures and visuals is something that we do include, because that's something that taps on their strength. And we want to really encourage him to build on that visual communication more, right? It not only helps him to express himself, but it also helps him to understand others around him. And there could be times that he's not able to understand what's going on, or when you tell him things, or when you give him verbal instructions. So visuals actually help him to understand, and then helps him to express himself better. So two things are happening when we use visuals, right? So communication is more effective and when we're talking about communication, we're talking about the two-way communication. You also have to understand what he's trying to indicate, right? So both ways, it'll be a more useful way of really understanding each other, and then encouraging him to, use pictures to express his needs or desires, what he's trying to say.
Okay, one more quick question, ma'am. Like,
Yes.
as a language therapist, do you prefer a colored picture or a black and white picture? And do you prefer
Usually, yeah.
bigger ones or the smaller ones? Like the size of a palm-sized
Okay.
pictures, or a bigger size pictures?
Okay, understand. Usually, we do not recommend colored versus black and white. We could use either of them. So it's not a must-have that you must have colored pictures. But in terms of the picture size, usually we go in for 1 inch or 2 inch symbols, picture cards for communication. This is for picture exchange communication system. If you happen to see very big picture, like big visuals in classrooms or in different places, those are more visual supports that people use to aid their learning, aid their understanding. But if the child or individual is on a picture exchange communication system and has a file and has a lot of pictures in it, those kind of pictures, usually the biggest one is 2 inch, and the smaller one could be 1 inch. So that's the size we look at. If you feel 1 inch is too small for your child, we would recommend 2 inch.
So the very
2 inch
smallest
visuals.
size you use.
So
Thank you, ma'am. Thank you so much.
yeah, I mean, yeah. So if 1 inch is too small, you could probably go in for 2 inch for communication purpose, right? Picture exchange communication system is where we are looking at. We do have the more low-tech text files or folders where we actually have lots of pictures and visual images. And usually we have like food or transport, animals. We usually place a lot of these in the folders or text files, we call it. And we could use that. Or nowadays, we also have the app version of these visual images. And one of the advantages is that it's less bulky. We can have a lot more vocabulary in an app as compared to in a file. And it can be constantly expanding, right? Because we keep learning new words. So that is also an option, right? You could have an app to work with.
Okay, ma'am. Thank you so much.
Thank you. Thank you.
Our next question from Priyanka, ma'am. You can unmute and ask your question.
Hello.
Yes.
Yeah, ma'am. Ma'am, actually, my son is 6 years old, and right now I'll try to show if I'll give him a picture where is a tree and an apple on the tree, and I will ask him, Vishu, where is apple? So he can ask me. He can tell me the apple is on the tree. Although speed is very slow, he will say like this: apple is on the tree. But if the same question I will ask Vishu, what is on the tree? Then he is not able to answer what is on the tree. So I have two questions, ma'am. The first one is this one, and the second question is that nowadays he has started like two-word communication. Ki, Mummy chal, या साइकिल चलो, like that.
Okay.
And if I'll ask him कि
Okay.
रिशु कहाँ जाएंगे हम, where you want to go, so after that he is not able to answer where he want to go. He's just telling me the
Okay.
things that, oh, yeah, because that things also I have told
Okay.
him.
So
When he started pulling me, so I have tell him कि you have to say कि mama cycle में चलो, so that he has learned, and that things only he is using. By on his own he is not communicating right now.
Right. So one thing very good about your child is that he's now starting to answer questions. So very good thing.
Yeah.
He's also combining words और एक sentence बना पा रहा है, कोशिश कर रहा है, and he's trying to string the words together, उसको join करके बता रहा है. But मुझे अभी भी लगता है कि consistent नहीं है. His understanding of the question, है ना? हम जिस तरह से सवाल को समझते हैं, देखिए जब हम सवाल समझते हैं, our ability to understand questions, WH questions जो होते हैं, who, what, where, ये सिंपल होते हैं, और एडवांस होते हैं why, what if, when, इस टाइप के एडवांस होते हैं. तो अभी तो ये सिंपल सेट में है, who, what, where. कभी आप पूछते हैं कि what is on the tree, तो कभी बता देते हैं where का आंसर, कभी वो नहीं बता पाते what is on the tree. But if you ask him what is this, तो मे भी शायद बता पाएंगे लेबल कि ये कप है. You know, तो his ability to answer a question, जो उनकी अंडरस्टैंडिंग है क्वेश्चन की, उस पे हमें थोड़ा और ध्यान देना होगा, उस पे थोड़ा और काम करना होगा. We may use visuals to teach. So आप pictures use करें, because pictures are visual supports. और one of the very useful techniques that we have is visual supports. उससे क्या होता है कि understanding भी बढ़ती है, not only expression, not only his ability to say. So जैसे आप पिक्चर यूज कर रहे हैं कि ट्री के ऊपर एप्पल है, दैट्स अ गुड टेक्निक. जब हम वेयर सिखा रहे होते हैं बच्चों को, आंसरिंग वेयर क्वेश्चंस, इट्स अ गुड टेक्निक. लेकिन अभी भी वो जनरलाइज नहीं कर पा रहे हैं, दैट्स द बिगेस्ट, है ना, जिसको हम जनरलाइजेशन एबिलिटी कहते हैं. सो आपका अभी भी इस पे और काम करना होगा. ट्राई टू थिंक ऑफ टीचिंग क्वेश्चंस थ्रू बुक्स. इंटरैक्टिव बुक्स यूज कर सकते हैं, कार्ड्स यूज कर सकते हैं, पिक्चर्स यूज कर सकते हैं. गूगल से हम बहुत सारी पिक्चर्स निकाल सकते हैं और डिफरेंट सीन्स, कि वेयर इज द बॉय, बॉय कार में बैठा है, एंड सो ऑन. सो कॉन्स्टेंटली जब हम एक अपॉर्चुनिटी दें घर पे कि हम सिंपल क्वेश्चंस का जवाब दें, लेकिन बहुत ज्यादा भी मत पूछिए सवाल, क्योंकि अक्सर क्या होता है हमारे बच्चों के साथ, ज्यादा क्वेश्चनिंग के साथ भी वो पुट डाउन हो जाते हैं, उनको पसंद नहीं आता, उनका इंटरेस्ट खत्म हो जाता है. सो कीप इट फन, कीप इट गोइंग. यही कहूंगी.
या मैम, मैंने इसके इस टाइप के प्रिंटआउट्स निकाले. मैं आई थिंक, आर यू एबल टू सी द वीडियो?
यस, आई एम एबल टू सी. वेरी नाइस.
अगर मैं इसमें क्वेश्चंस पूछती हूँ तो ये मुझे आंसर दे देता है, लेकिन अभी जनरलाइज नहीं कर रहा है मैम. लेकिन जनरलाइज
तो अभी आपको थोड़ा और काम करना होगा. इफ यू आर वर्किंग विद अ स्पीच थेरेपिस्ट, उनका सपोर्ट भी ले सकते हैं कि आपका नेक्स्ट स्टेप क्या होगा. सी समटाइम्स स्पीच थेरेपिस्ट गाइड अस कि हमें आगे क्या करना है. अभी तो हम कर रहे हैं, बट दे कैन हेल्प अस टू प्लान अ प्रोग्राम कि आगे क्या करना है, या अभी जैसे आपका सवाल है कि और क्या कर सकते हैं. सो ऐसे पिक्चर्स आर वेरी यूजफुल. आप बहुत अच्छा कर रहे हैं. और ऐसे आप टेबल टॉप में एक स्ट्रक्चर्ड वे में सिखाएं, और फिर उसको जनरलाइज भी करना सिखाएं कि जैसे आप पार्क गए हैं तो पूछिए कहाँ बैठे हो, मैं स्लाइड पे बैठा हूँ, या ऑफ कोर्स हम पेड़ पे तो नहीं बैठते, जहाँ पे भी हम बैठ सकते हैं उसको हम अपॉर्चुनिटी देंगे टू टॉक अबाउट. और सिर्फ बच्चे से नहीं पूछना, मेक इट इन अ फन वे, एक इंटरेक्शन की तरह कि हम भी बताएं हम कहाँ बैठे हैं, और फिर वो भी बोलेगा कि वो कहाँ बैठे हैं. सो लेट इट बी मोर इन अ फन वे. इससे करने से बच्चे को ऐसा नहीं लगता कि सारा फोकस मेरे पे है, और उससे डिमांड बहुत बढ़ जाता है बच्चे.
ओके मैम.
ओके, थैंक यू प्रियंका. थैंक यू.
Next, Aga ma'am.
Yeah, ma'am, this is Antara. Ma'am, good evening.
Good evening. Good evening.
I have a 8-year-old son, and he
Okay.
communicates well. He is verbal, and he also follow commands and put his needs verbally. I mean, he's very much communication wale mode pe hai. But I'm facing two issues.
Okay.
First, he's very loud. I mean, whenever he asks, whenever he talks, even if he's sitting just beside me, he talks like कि जैसे वो 3 कमरे दूर मुझसे बात कर रहा है. So I keep asking and telling him, Laksh, थोड़ा धीरे बोलेंगे हम. But probably this is not the right way uh, to teach him to maintain his volume. So he's very, very loud. I'm not able to make him understand the voice modulation and the articulation thing.
Understand.
So, because he's
Yeah.
also going in a mainstream school, and many times I tried when he had to enact or participate in some speech or something. So I was just writing on a board, and then he was reading. So for that, that's fine. But recently, what happened? He had to make a video to wish his cousin happy birthday. So what I did, I wrote on a board, and he started reading simply, without any voice modulation, without anything, and happy birthday. So he was reading, and I was trying to teach him that this is not the right way. You have to give pauses, you have to modulate your voice. So this thing I am
Understand.
facing, I don't know how to go ahead. The other thing, whenever I
So
talk,
thank
or
you for
maybe,
sharing.
if I'm using,
Definitely, it's very good to. Yeah. Yeah.
and he's not able to comprehend things. Like if we are reading some books, if we are, I'm telling some story or maybe bedtime story, so he reads and he's pretty much involved. If I ask 1 2 questions, very simple question, he may reply, but he's not able to comprehend even the basic stories like tortoise or rabbit.
Yeah. So again, I'll answer the first part first, regarding the vocal volume, the volume of our voice, right? So, like I mentioned, this is one of the subtle skills in communication, and an advanced one, where we have to really build certain techniques to make the child more aware of his volume and his loudness level, right? On his own at the moment, he's not able to have that understanding that where I should be loud, which
True.
context I can be loud, which
Yes.
place I have to be more quieter, or how others are feeling. So there's a few things happening. One, he's not able to have that awareness right now about others in the room, right? And take their perspective that it's too loud for them, right?
Yes.
And they are not comfortable. And plus at the same time, when we tell him also, he's not able to modulate it right away,
True.
right? So we need to probably adopt visual ways to teach him about his voice. One way is that sometimes a lot of the parents, they will record their voice and let them hear it, and let them compare, give them a model that this is an appropriate voice, or it's an okay voice, and this is too soft or too loud, right? And then they verbally reason it with the child that, when it's too soft, mommy cannot hear you, mommy cannot understand you, or teacher cannot understand you. The other more useful way is where we use visuals. So we may actually use a social story to and make a story about loudness, that we tell him in a way that teach him in a way that today we are talking about loudness, and or we can make it in a story format. We can use make a story about maybe another boy, not him, and tell him about that, that it's okay to be loud when we are at the playground or in a field, but it's not so okay to be loud in a library, or I
At
can
home.
talk, or in a more positive tone, we can tell him about where he can be soft, or where he can be loud. We need to build that understanding first. Right now,
I mean,
he's
he is
lacking
able
that
to
social
understand that.
understanding of.
He's able to understand that because at night when somebody is sleeping, and when we start murmuring, we talk very slowly that don't make noise. He's sleeping, so he also talks like this. So he understands. Now we have to be very, very gentle or very low in volume. So
Yeah,
that
but he
understanding is
may.
there.
Yeah, but he may not be able to generalize it across all
Probably
situations
yes,
we see,
yes, yes,
right?
ma'am.
So
Yeah.
that may also be. The other thing is that sometimes when we are teaching children, we use like a thermometer, like a vocal chart. If you Google, you can actually find some samples, and you can actually make like a chart, like a vocal thermometer, where you actually visually tell him where he is when he's talking. So if have it on the table when you're talking to him or having a conversation, show him where he is and how he could come down, right? So it's a way to teach him how to monitor himself. So it can be a very visual technique to be able to, it's called a visual thermometer. You can actually print it off the internet. There are a lot of samples there, and you can also draw your own, right? So you can draw
By
it
the
on a
name of visual
whiteboard.
thermometer. If I
Yes, so
Google,
you can
okay,
actually, yeah, you can it can be called a vocal thermometer also. And you
okay,
can also try and find some social stories to teach
sure.
loudness and how to monitor that loudness level. So we need to keep doing it, because generalization hasn't really been achieved yet, and he's still not consistent in every area he's doing it, right? So
Yes,
he's
true.
understanding, like you say, sometimes, but sometimes you have to still tell him, right? So we need to still build this concept of loudness, and what effect does it have on others when I'm too loud or too soft, right? We need to build that understanding. We need to reason with him why we can't do it, or why we do it like this, right? So we have to engage with the child in and teach him this concept. It's a very abstract concept. We cannot teach anybody just like that or tell him that, okay, speak softly, right? You and I can
Actually, ma'am,
understand,
earlier I
right?
was
Because we
using
are
like
taking
what I
others'
learned from,
perspective.
yeah, like my therapist, she told me that you also reduce or low down your volume, and they then say that please talk slowly, softly. So I was using the same technique, but it's not working.
Yeah. So you can use that. I'm not saying that any one particular technique is useful or not useful, but we may have to use a few techniques.
True,
Sometimes
true,
one
agreed.
alone may not work, right? So we need to use
Yes,
a combination. Always remember that a combination of techniques, strategies, or methods, right, may work.
right.
And sometimes you may feel that, with this child I have to use maybe other ways, more visual ways. And of course, visuals help them understand what we are trying to say, right? So that's why we are using visuals to teach, to explain, to help them understand, and hopefully that will they will be able to grasp it better, right?
Okay, so it
So
means
एक
like
बार
when
में नहीं होगा, we may have
he's
to do it a
loud,
few
so I'll
times.
show him the thermometer and I'll increase. I'll take that that cursor kind of thing to up that you're very
Yes,
loud. I'll
correct.
make it okay. Fine, ma'am. Yeah,
Yes.
I'll do that.
So you need to move that and teach him how to monitor while you're having a conversation. जब
Sure,
आप जो भी activities कर रहे हैं उसमें use करें, throughout the day
sure.
use करें. That is how we show this child how he can, because right now we support first. Then your goal is, once he's starting to understand, the goal is to make him independent. How can he do it by
True.
himself? How can he remember to do
Yes.
it by himself?
Sure,
And
ma'am.
that's the
I'm
modulation of
hoping that
voice.
it will work
I
cause
mean, the
he's pretty
volume
much
that
visual.
we're talking about.
Okay. Okay. Thank you, ma'am.
So you can always try and do give us feedback if and how it moves on, right? Thank you. Thank you.
Okay.
Thank you, ma'am. Next question. I will move on. Arav S. You can please unmute and ask your question.
Good evening, ma'am. I'm mom, Ariv's mom. He's 4 year, 9 month old. He can speak small sentences. The thing is, when he sometimes when he speaks, he has some
Sorry,
incomprehensible language.
actually, I'm not able to hear you well.
Yes, your voice is not clear. We are not able to hear you.
Uh, yeah, can you hear me now, ma'am?
Yes. Yeah.
Are you
Try.
or am I audible? Yeah, I'm Arif's mom. He's 4 years, 9 months
Yes.
right now. he can speak in small sentences. He can indicate his
Okay.
needs. At sometimes in a day, he speaks for a in an incomprehensible language while he's playing alone.
Okay.
Like
Okay.
he will play with he will make his own trains. He will draw the trains on the room. He will while he's doing, like, he makes some no incomprehensible sounds, and after sometimes when I try to imitate it as a sound of a train or something, or give meaning to it, he will start he again makes some other different kinds of sounds, which I cannot understand. Now, like, how can I make him to speak in a make this incomprehensible sound to a normal speech, like what
Yeah.
this
Uh, okay. Sure. Thanks for sharing. See, what happens is that a lot of our young children, when we are sitting with them, we are trying to engage, we hear less of this what we call, we are not able to understand, we call this self-talk. And the child is talking something, we are not able to make sense of it. समझ नहीं आ रहा है क्या बोला है बच्चे ने, and it's not relating to what he's doing. It may be something else, or we are not able to understand and comprehend whatever that sound is. It's not really understood by us, right? So a lot of the times we see this behavior when the child is by himself, not in a very engaged fashion. हम बच्चे के साथ नहीं बैठे हैं, and he is doing something by himself, and he's often engaging in this self-talk, where he is making some sounds we are not able to understand, or it's not very related. So what I would suggest is, one of the tips that we usually give for to really work with such children is to connect with them as much as we can, to engage them. Engagement is important. So if you notice, I know we can't do it 24/7. There is bound to be some time the child is playing on his own, and the child needs to have some downtime also. That means his own playtime.
After this kind of speech, I feel that he's happy and coming and speaking with me in a better way. Like he speaks with me after he plays for some time. Then he will come and connect with me, and he will try to come and find me where I am, and he will come and speak with me.
Yeah. So he wants that interaction. The way I hear is that the child is coming to you. He wants to interact at times, which is a very good sign. We want to make this more. So what I'm suggesting is, try to connect with him when he's making these sounds, and direct it, model the correct sounds at that time. So if he has a train and he's fixing a train, we are going choo choo, chaga chaga choo choo. Here comes the train. या कोई train का गाना गा रहे हैं, या we are actually making a train sound and rolling the train on the track. We are trying to, or maybe we are counting the carriages of the train. 1, 2, 3. Oh, long train. It's a long train. So we are actually talking, connecting with the child, engaging this child back. And a lot of the times you will notice that when the child is engaged, the self-talk is minimal or is lesser, right? Okay. I'm not saying self-talk will not happen, but what we want to build is
leave him during the time, or I should make him to I should try to speak with him, connect with him, and I should reduce it, or shall I leave him? That's what I'm confused on.
Yeah. At that point, if he's having self-talk, I think the voice is not so clear, so I'm not sure if I missed your question. But what I can make sense of is that when he's having this kind of talk happening, or he's making these sounds or words, and you're not able to understand, that is the time where you go and connect with him, engage him, try to do, you distract him into, or make him, focus on what you are doing. So as a mother, you are the facilitator. You are going to show him, you are going to play with him and make that train. आप भी गाना गाएंगे,
आप भी train के बारे में कुछ बताएंगे. You will use keywords or you will combine words. Give him those words. Sing a song. We will sing a train song. Or then you want to really see whether the child is, because connection is important. This is what we are talking about today. Connect with your child. Do a countdown. 3, 2, 1. Here comes the train. आप बच्चे के साथ connect बनाएं. The engagement is important for communication. अगर बच्चा engaged नहीं है, so he is talking something else, आप कुछ और बोल रहे हैं. Both are not related, right?
Yeah.
So what we want to do is to redirect him and connect with him again.
Okay.
It's okay if it takes maybe 1 try, 2 tries. Connect करिए. If train is not something he's showing interest, we can follow his lead. मतलब आप बच्चे को देखिए, ऑब्जर्व करिए कि वो किस चीज को करना पसंद कर रहा है उस समय, उस टॉय को लेके आइए, कनेक्ट करिए दोबारा उस टॉय के साथ. फॉलो द चाइल्ड्स लीड. ये एक बहुत बड़ा स्ट्रैटेजी है कि हम जो बच्चा करना चाहता है, वी अलाउ हिम टू डू व्हाट ही वांट्स टू डू एंड फॉलो हिज लीड. एंड बाय डूइंग दैट वी गिव हिम वर्ड्स. उसके बारे में बात करेंगे, उसके साथ एंगेज करेंगे, खेलेंगे. It's important to come to his level and play. And hopefully the self-talk will lessen. कम हो जाएगा, या for that moment it will go away, and he will, once he's connected, once he's engaged, he will look at the toy, he will look at what you're doing. आप करके देखिए. But at this point of time, ऐसा नहीं है कि ऐसे ही रहेगा. आपको you have to throughout the day give him lots of opportunities. Interaction बहुत जरूरी है as parents. You have to spend time with the child, that face-to-face interaction घर पे, using his usual toys. कोई ऐसा equipment नहीं चाहिए. Usual toys and books or the items that the child likes. उससे ही हम engage कर रहे हैं, उससे ही हम language and vocabulary जो words हैं वो दे रहे हैं. And that connection is important, that people connection. So interaction की होता है communication के लिए, वो करना बहुत जरूरी है. And otherwise we notice that the child is playing by himself, लेकिन हो सकता है he's engaging in some kind of what we call verbal jargon. मतलब कुछ ऐसे words हैं जो हमें समझ नहीं आ रहे. It can be something else कि वो बात कर रहा है, हमें समझ नहीं आ रहा. It's not relating with that context जो बच्चा कर रहा है. So उस समय you are here to support him. आप हेल्प करेंगे, उसको रीडायरेक्ट करेंगे, आप मॉडल करेंगे, आप शो करेंगे, आप उसके बारे में बात करेंगे या सॉन्ग गाएंगे, है ना, डिपेंडिंग ऑन द एज ऑफ द चाइल्ड. आई एम टॉकिंग अबाउट एक्टिविटीज एज स्पेसिफिक. 4 साल के बच्चे के साथ हम फन एक्टिविटीज करते हैं. वी ट्राई टू प्ले, वी ट्राई टू do a little bit of pretend ki choo 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 choo, ruk 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 on the station, and then chalo chalo, and then the train moves again. तो उस टाइप की एक्टिविटीज करते हैं बच्चों के साथ, यंग बच्चों के साथ. But if it's an adult or if it's an older individual, I may not be doing this. I may be doing more age appropriate, developmentally age appropriate activities. So connect करना किसी के लिए भी, this goes for everybody. Connection, engagement is very important for communication. और वो, that is the key, the prerequisite for us to have a good dialogue with anybody, a good conversation with anybody.
Yeah, thank you, ma'am.
Hopefully I've answered.
Yes. In detail and very nicely explained.
Okay. Thank you.
Last question I would take for today is
Okay.
Ankita Sethi. You can unmute and ask your question.
Hello. Good evening, ma'am.
Good evening.
Ma'am, my son is 6.5 years old and he is verbal. He can speak sentence and he can answer also. The main problem I face is of eye contact. What happens is that if anything which he wants from me and he knows that I will give it to him only when he will give me an eye contact. So at that time, he will give an eye contact. If he does something wrong and he knows that it is wrong, again, he will give eye contact to me. When we are making his video or when we are clicking the pics, photographs, then also he gives the eye contact. But when we communicate with each other or when I'm talking with him, then there is no eye contact. Although I've tried in all the ways ki look at me, then talk to me, otherwise I will not listen to you. And if he at that time gives the eye contact, it's not normal. He is like penetrating in my eyes or coming closer to me and just try to give the eye contact. Means it's not natural. So I'm not able to get it ki when he wants to give the eye contact or why he is not giving at that time when he is simply talking to anyone, either to a teacher or with a friend or anyone.
Okay, thank you for sharing. देखिए, see, eye contact, a very important part of communication, we know that, and a very difficult one to teach. We do not really directly teach eye contact by saying कि मेरे को देखो, मेरी तरफ देखो. If it was that simple, I think we won't be having this question. But eye contact, again, in your child's case, it's very simple. He's trying to, whatever he's interested in, he's trying to look at it, and is able to alternate his eye by looking at the person, looking at the object, या toy, जो भी वो कर रहा है, device, and then look back and forth very reasonably well. लेकिन when it comes to an individual, जैसे आपके साथ interaction हो रहा है, people's interaction, there, that's where the demand is. That's where the challenge is to look at the person, is and to think about what I have to say it. बहुत कुछ है करने, socially demanding, and that is what is making it challenging for him. It's a lot more effort, and he may not be feeling good about it. उसको वो demand लगता है, इसीलिए वो withdraw करता है. He hesitates, or he doesn't want to kind of keep looking at you while he's doing it. So when we are really working on eye contact, we don't really directly teach eye contact. But क्या करते हैं, जैसे आप face to face, one, try to always sit face to face in a you know, by looking at, like two people are looking at each other when we are having, just like how जैसे हमारा conversation होता है. Even Zoom पे भी हम लोग screen में camera की तरफ देखते हैं,
Yes.
hoping कि हमें देख पाएं, right? So we are always careful about the way we are, the way our body is, the way our eyes are, how we are positioned when we are talking. So ये भी ज़रूरी है सिखाना, right? But it may not happen immediately that he starts looking at us. So when you are doing, let's start with structured activities. जब आप कोई भी activity कर रहे हैं उसके साथ, start with those first. That whatever activity you are taking, hold the cards or the pictures at your face level, so that he will look, because young children क्या होता है, they are very object based. उनको object को देखना है या device को देखना है. They are not so much interested in our faces or the way or at us, and that is where the demand is. So always hold it up when you are trying to show things, कुछ चीज के बारे में बात कर रहे हैं, या whatever you are interacting about, hold it at your face level. And that way he will have an opportunity to alternate his eye movements between you and also get your cues. हमारे facial cues नहीं तो miss out हो जाते हैं. That's why we are worried about eye contact. We want children to look at us. नहीं तो सब miss हो जाएगा, है ना? And by telling the child, इधर देखो, मेरे को देखो, it may work, it may not work, because अगर उसका mood है तो वो देख लेगा, but for a second and then he will look back again. एक मिनट देखने के बाद वो फिर देख लेगा साइड में. So it may not be consistent. Another thing I want to tell about eye contact to everybody is that eye contact हमेशा एक जगह नहीं रहना चाहिए. It should not be sticking, your eye not be sticking at the person for a long time. No, it becomes staring.
Yes.
आंखें ऐसा नहीं होनी चाहिए. You should not position your eyes in a way, and let's not teach it that way कि इधर ही देखते रहो. No, that becomes staring after a while, a very socially inappropriate thing to teach. So we need to teach how to alternate. हम देखते हैं, फिर कहीं और देखते हैं, फिर वापस देखते हैं, फिर कहीं और देखते हैं, वापस देखते हैं. हम एक ही तरफ नहीं देखते, फिक्स नहीं कर लेते अपने eye gaze को. So it's important that our training, our teaching, as parents and professionals, we take into consideration these things. That hold up the object, let him alternate, and positively reinforce him. उसको बहुत शाबाशी देना है. Praise him for good looking, even if he looks at you 2 times out of 10 times. Praise him. Tell him बहुत अच्छे से देखा आपने. Good looking. Another technique is also have a visual support. एक visual आप टेबल पे रख सकते हैं जब भी आप interact कर रहे हो, which shows look at person when talking. This is a rule. You can also use social story to explain to him that when we talk, when mommy talks to you, we look at each other. This is part of talking. We need to tell our children, tell the individuals we work with, this is part of talking. ये भी एक part है. आपके words important हैं, but you also need to look your body language. Let's talk about these things. Break it down for the child. Talk about how important body language is, how important your face is, how important your eyes are. Let's talk about the whole body, not only eyes. And always remember to praise the children for their good attempts. Because we always are using a very positive way of, reinforcement. And this is not costing us anything. Free, absolutely free. I'm personally not so much into edible reinforcement, but I am more for social reinforcement, praise. बच्चों को even if they do it 1 out of 10 times, 2 out of 10 times, praise them for their good effort, praise them for their good things, what they can do well. क्योंकि weakness का जो area है उस पे तो हम काम कर ही रहे हैं. That is why we are working with them. That's why we are sitting down with them.
Yes, and praise really works.
Make learning fun. Praise really works. And when we praise them, they do it again. They want to do it again. This is what we want. We don't want to force them कि अभी दोबारा करो. वो नहीं होने वाला. क्योंकि effort again is not something that we can, it's a big effort. Communication effort होता है.
Yes, ma'am.
हम सबके लिए भी होता है. उनके लिए, with that difficulty, it may be a lot more, and sometimes they give up. If they have low confidence, low self-esteem, they may not want to continue. इसीलिए वो छोड़ देते हैं. So we need to break it down for them. उनको support करना है.
Ma'am, one thing I will say कि I think that they are very smart. मतलब my child is like that. If I show him any card or any pic na, he will just give a glance and he can answer. So मतलब I couldn't make out whether he has given an eye contact or whether he has actually seen that or not. So because I have tried with that also, that it should be at the eye level, because therapist always suggests that whenever you are talking or try to give an eye contact, set it at the same level. The card should be at the same level. I tried it for 2 years approx. When he was 4, 5, like that. So I know that at that time he is looking and just giving a glance and just moving his face here and there. So when I'm just talking, I know that he has given a glance and he can answer the question. What is it? He just gave a glance and he can say that it is a toy. But now what should be the strategy if I have done this thing face to face?
So one thing is that he's very visually strong. He's responding very well. He understands the picture just with a glance. Very good.
Yes.
That's his strength. लेकिन अभी आप you can use social stories, like I said. Have visual rules in the room, जहाँ भी आप काम करते हैं. Have some rules about looking at people when we are talking. Conversational rules के बारे में बात करेंगे. You can print out some visual rules from the internet and have them visually उसके सामने उसको दिखाएंगे जब भी हम बातचीत करने से पहले कि आज हम किस चीज करेंगे उसके बारे में हम बात करेंगे. You have to reinforce it. एक बार दिखाने से नहीं होगा, आपको वो बार बार जब भी बात करें, जब भी एक्टिविटी करें, उससे पहले go through it again. And the moment he does well, maybe you can have a reward chart, have a way to tell him that he's done it well. Even small little changes, बहुत बड़ा change एक दिन में नहीं होगा, आपको small changes पे ध्यान देना होगा and उस पे बहुत praise करिए if he's doing it well, because small changes ही एक बड़ा change लाएगा. So that's important. And maybe you can try some of these visual methods of making him understand better, because visual supports उसको अच्छा समझा पाएंगे and he will be better able to also view it. So आप laminate करके उसको टेबल पे लगा सकते हैं, या उसके वर्क एरिया के पास लगा सकते हैं, या उसके कमरे में लगा सकते हैं. You can show him. It should be easy for him to see. क्योंकि अगर hidden होगा, अगर आप verbally ही बता रहे हैं, उसको रिमाइंड करें, तो मे बी ऐसा होगा कि आप बार बार बोल रहे हैं, एंड समटाइम्स इट्स टू मच ऑफ ओवरलोड. बहुत कुछ बोल रहे हैं हम लोग कंटेंट भी सिखा रहे हैं, हम रूल्स भी बार बार बोल रहे हैं. इट्स टू मच फॉर द चिल्ड्रन और द इंडिविजुअल्स, टू मच वर्बल ओवरलोड. वी आर कॉन्स्टेंटली डूइंग समथिंग. इसीलिए वी अडॉप्ट विजुअल supports to help them understand. While I'm teaching, मैं बार बार rules नहीं बताना चाहती. I just tap on it or I just point on it, and he knows कि वो rule मैं बोल रही हूँ कि वो करो. I'm expecting you to sit properly, or I'm expecting you to look at me or look at the book. Be specific. Another rule, another technique. Specific rule लिखिए. If he can read, we write specifically, look at mummy, look at teacher, or look at friend. सिर्फ look नहीं. So it is a specific instruction. We need to understand कि हम क्या लिखेंगे visual rules. Very important to keep in mind, क्योंकि some children need specific rules. General rules से वो नहीं समझते. If I just write sit, the child has no idea कहाँ बैठूं. वो floor पे बैठ गया, but ideally he's followed the rule very well. वो बैठ गया. And then I go and say, no, sit on chair. So good that at least now he understands sit on chair. I know exactly where to sit. Yes. And then I say, good job. बहुत अच्छे से आपने chair पे बैठे हैं आप, and keep up your good work. लेकिन अगर मैं सिर्फ sit लिखूंगी तो वो कहीं भी बैठ सकता है. He can sit on a black chair, he can sit on a red chair, he can sit on a stool, he can sit on a sofa, he can sit on a झूला, anywhere. It will not help me, and मैं ज्यादा काम करने वाली हूँ उसके बाद. So it will deviate me. जो मेरे को काम करना था, जो मुझे सिखाना था, वो मैं नहीं कर पा रही. मैं ज्यादा टाइम इसमें लगा रही हूँ. So we need to be very careful कि हमारा जो जब हम कुछ भी सिखा रहे हैं, तो what is the goal, क्या सिखाना चाहते हैं, उसको break down करेंगे पहले. We can have many things in place. So strategy अगर specific होगा ना, it will probably be better able to support him. नहीं तो बहुत generalized होगा, तो हमें भी ज्यादा टाइम लगेगा बच्चे को समझाने में कि हम क्या चाहते हैं. What is the expected behavior? क्योंकि अगर expectation clear नहीं है, तो it will be difficult for the individual with autism. They will be confused. Ambiguity नहीं create कर सकते हम. We need to make it clear, concise. That is important.
Thank you so much, ma'am. It was a very informative session, and we really got many new things to learn from your session. Thank you, ma'am. Thank you.
Thank you so much. Thank you.
Yes, it was a wonderful insight and a wonderful knowledgeable session, ma'am. Thank you so much, everyone, for joining in. And
thank you, Harshali. Thank you so much.
Looking forward for next part 2 on next Monday. I would request a participant to again join in for part next Monday, same time, 6 o'clock. And one more request is like we are closing early, but from National Summit for Special Needs in 4 days. So if you have not enrolled yourself, please do that. And with that, I again want to thank you, ma'am, for taking taking out so much time and energy for us. Thank you so much,
No,
ma'am.
not a problem. It's a pleasure. Thank you, Harshali. Thank you so much.
Thank you so
Thank you,
much.
everybody. Thank you for listening. Thank you. Thank you.
Thank you. Good night and bye-bye.
Thank you so much. Good night.